Big struggle for some, but there are things you can do right now to help. Barbara Moore Silva busts some of the biggest hair loss myths and introduces us to a new way to treat it.
A baseball cap does not cause hair loss, and here we see the Red Sox playing, and they take off their hat, and some of them are bald, and people have said, yep, it's the cap that did it, but it isn't. Genetics causes 90% of all hair loss.
Something that does cause hair loss?
So there's a condition called traction alopecia where the long-term pulling of the hair follicle actually destroys the follicle, and it's most commonly seen in people of color who've had braiding over long term.
So let's say for whatever the reason you're losing your hair. There are non-surgical solutions. There's this capillus laser cap, which helps slow hair loss and in many cases promotes hair regrowth. But there's something even newer, something Dr. Leonard is now offering to his patients. It's called Platelet Rich Plasma, or PRP injections. They've been used before to repair cartilage.
You've heard of the vampire facelift, where it can be injected into the face. Well, now we have a treatment for hair loss using platelet-rich plasma.
This is done using the patient's own blood.
We put the blood into a centrifuge, which is a spinner, and it separates the blood cells, the red blood cells and the white blood cells, from the plasma.
The platelets are then put into a syringe and injected into the scalp. It's something former Patriots player Rob Ninkovich recently had done in Dr. Leonard's practice. How soon would people start seeing hair regrowth?
It's not tomorrow, that's for sure. It takes a while. Anything to do with the hair cycle takes at least 4 months.
The FDA has also approved platelet-rich plasma injections for treating hair loss. A blood test could help identify people at risk for Alzheimer's disease before any symptoms start. The test, developed in the U.S., measures the level of Alzheimer's-related proteins in the blood to help predict if they have accumulated in the brain. Preliminary studies show the test was 94% accurate when combined with other factors like age and genetics. However, experts say more research is needed before the blood test will be made widely available.